I'm on. Good evening, students. I am your usual anchor on this subject known as disaster and emergency in nursing. We discussed comprehensively last week, so I use the opportunity to welcome you back again to this week. In this week class, before we start new topic, we need to revise what we have taught last week, if it's been properly digested, to make a review. Last week, we defined what disaster and emergency in nursing is, according to World Health Organization, that define it as a sudden occurrence of the event that causes damages, ecological destruction, loss of human life, the degradation of health services on a scale that is sufficient to warrant an extraordinary response from outside the affected community or the area. Well, after defining that, we're able to look at the types of disaster we have. We're able to discover that we have two types of disaster: an emergency in nursing. They are, as been mentioned, natural disaster and man-made disaster. And under natural disaster, we are able to discover that natural disaster are the naturally occurring physical phenomenon that is caused by rapid or slow onset of events. Then we're able to know the type of natural disaster. One of the factor of natural disaster or classification of natural disaster, we're able to discover that one, geographical disaster is among one of the prominent classification or types of disaster. And under geographical disaster, we made mention of earthquake, we made mention of landslide, we made mention of volcano activities, we made mention of tsunami, and we made mention of surface collapse. When we now went further on classification to say hydrological disaster is another type forms of classification of disaster and emergency. Under hydrological disaster, we made mention of types which include flood, type of disaster, hurricane, and we give a sample of hurricane, and that type is tornadoes and volcano. The third class is climatological disaster. Under climatological disaster, we may mention that prominent under that is drought and wildfire, where fire is just burning wet grasses, and as if it's being fueled to burn. And drought, when most of animals and their foods are destroyed due to drought. Then the last one under natural disaster, we may mention of biological disaster. Under biological disaster, we may mention of diseases which could be endemic, it could be pandemic, it could be epidemic, and such as viral or bacterial infection like Ebola, like other diseases that can spread easily around community through insect bites, animals, or plagues. Then the second phase of the disaster classification, we may mention of man-made disaster. Under this man-made disaster is an event that took place, or the event that is taking place due to human activities and human negligence. Man-made disaster also classified into two. One, we have technological disaster. The major example of technological disaster are industrial accidents where precautions are not taken when caring for machineries, instruments, equipment, chemicals, and sort of under industrial accident. We have transportation where we have accident from air accident, we have road accident, we have water accident. Series of accidents that can happen through mechanical faults or mechanical factor are also known as transportation disaster. We have complex conflict, terrorism attack, we have nuclear weapon where a lot of biochemical weapons are exposed due to war, like what is going on now in Iran, Israel. We have a lot of biochemical weapons that are being used to attack the common civilians, in which after some years or some years to come, the generation unborn will be affected due to nuclear weapons that have been used for that period of time. So that disaster is happening due to man-made disaster. We may mention again due to environmental factor under man-made disaster. Environmental factor, these are the common problem we have in our environment, like land degradation and this desert desertification of our environment is known as environmental factor. Then we went to phases of disaster, and the phases of disaster, we made mention of mitigation. Mitigation can be defined as effort to reduce or loss of life and property in the event of disaster by lessening the impact of disaster. It means taking action now before the next disaster to reduce human and financial consequences later. Under that, we made mention of rescue, where after disaster or emergency has exploded, the first phase of the first phase of that mitigation is known as rescue mission. In rescue mission, this commence the search and rescue of victims in case of building collapse or activity that has a buried woman underneath the ground. The first thing they need to do is to do rescue mission to separate people that are hurt from people that are not hurt, where they are able to take accurate number of people that are living or people that are dead. Then the second phase, the third phase is relief. When after the whole war, after the whole disaster, then the next thing is provision of relief material. Under the provision of relief material, we talk of food, adequate provision of food. We talk of water provision. We talk of temporary shelter. We talk of transportation that is going to convey these people from the accident area to a very safe area. Then we talk of emergency health care, where we need to manage these people, removing them from the scene of accident or occurrence of disaster. We need emergency health care, like primary health care, secondary health care, or even tertiary health care. Then next one, we have preventing of disease, in which after you have settled these people that are just coming up from disaster area, where we need to settle them and prevent disease such as malaria, such as bacterial infection and series of infection. After the being rescued from the disaster and emergency scene, they need to get them settled down, and because of their settling down, we give them adequate provision that is going to prevent them from having such an occurrence of diseases. In preventing diseases and disability, those people that are disabled are rehabilitated back again, back to their normal life. People that have lost their limb, upper limb or lower limb, they need to rehabilitate them by providing their processes and all sort of that is going to make them back to their feet again. Then we talk of rehabilitation. How do you rehabilitate people after the whole war? You see, after the whole war has destroyed a lot of things, or after disaster or emergency had happened, it has destroyed a lot of things. Under rehabilitation, you think of how to put those people back again to their feet, on how to make them to make them live a normal life. So by rebuilding their infrastructure back, their houses, by rebuilding these destroyed houses, by bringing healthcare back to their nearer to them, where they need to consult when time they are sick or they are down with ailments, then with other basic necessities need to be provided. So those are the things we have discussed so far. I hope that now we have recapped so that we can progress forward. In this week, we are going to hammer much on triage, disaster triage. On disaster triage, the word triage is simply derived from a French word, which means trial. This means to sort or to choose. Triage is the purpose of prioritizing which patients are to be treated first, and is the cornerstone of good disaster management in terms of judicious use of resources. Triage is the process which places the right patient in the right place at the right time to receive the right level of care. In triage, in case of rescue mission, many people are injured, many people are battered, and many people are affected. So you gather all of them in a health center. In the health center, you now choose among them which one needs immediate management. People that are bleeding and somebody who is not complaining of pain, or somebody that is complaining of pain and somebody who is bleeding, who is more important? Somebody that is complaining of severe pain and somebody who is bleeding, who is more important? Under triage, we believe that somebody who is bleeding is more important than somebody who is complaining of pain, because it's when you are alive, when you are still active, that you know you are in pain. But when you are bleeding, you need to listen to that person first to take care of the patient that is bleeding first. Under triage, we sort out those people that are bleeding. We sort out people that are having difficulty in breathing. We sort out people that are in bad condition that require your immediate attention. Then triage separates the injured into four classification. We have under triage, we have four classification under triage. First classification under triage is known as priority one. Priority one under triage. Priority one under triage simply state that emergency red code. Emergency red code under priority one. This group consists of those who are severely injured and expatiate health facilities. Severely injured, I told you, people that are having crush injury, that are bleeding, people that are having a compromise of breathing system, their heart is ceasing or their breathing pattern is ceased. So those people are more important under priority one. Then under priority two is known as urgent yellow code. As the first one is known as emergency red code. The second priority, which is priority two, is known as urgent yellow code. Urgent yellow code are people that are fined under this urgent yellow code are the injured whose care and transportation can be delayed. Are those in this group, that is, they are not too severe. When you go there, you see somebody that is breathing, but the breathing is compromised, about to cease respiration, and somebody that is bleeding profusely, and you see somebody that is in pain, is just shouting of pain, and you have ability to move one or two person. The person that you are allowed to move under this code is person that is severely bleeding, as the person that is severely bleeding, and somebody who is having respiratory compromise, that you cannot breathe well again. It may require oxygen, it may require immediate attention, and the person that is bleeding will require other urgent treatment and urgent surgical emergency. So those are the people that fall under priority two, known as urgent yellow code. Then the third one is priority three. Under priority three is known as non-urgent green code. Non-urgent green code. Where you see non-urgent green code, the code there will be green. So in the under non-urgent green code, they are those with minor injuries who need care less urgently. Somebody that is complaining of pain, they are not as severe like somebody who's under red code or yellow code. So green code are people that are having minor injury, bruises, maybe simple fracture, or person that is just complaining of headache after the whole accident has happened. They are under this code. Then the last code, which is the priority 4, is known as expectant black code. Expectant black code. These are victims who are dead or expected to die due to diversity of their injury. Examples are victims with massive head injury, extensive full thickness burns. Maybe somebody is having burn and is expected to die, and somebody who is dead. In the course of you going through rescue victim, you don't pick people that are dead, or you know that they are going to die first before somebody that is having much difficulty in breathing, or somebody that is bleeding profusely. No. People that are dying and people that are dead and patients that are liable to die, they are all under priority 4, known as expectant. And that expectant is marked with black code. they are expected to die. No matter how do you do, no matter how you handle them, they are still going to die. It's having severe head injury that nobody can manage. So you don't take care of those ones, leaving those that are bleeding, those that are having respiratory tract infection, problem that cannot breathe well, that require oxygen, and those that require immediate attention surgically or medically. So these are the three groups. These are the four groups that under triage. We have priority 1, which is no marked with red code. We have priority 2, which is marked with yellow code. We have priority 3, which is marked with green code, and we have priority 4, which is marked with black code. Under black code, people that are dying or are dead are under black code. Now let us look for, we have treated triage. Let us look for reasons for disaster triage. Why do we practice triage under disaster? Disaster triage is needful in the management of mass casualty for the following reasons. Mass casualty, when you have mass patient, maybe they are bringing patient with maybe accident or victims, and they are bringing in much patient in. When they bring this all in a health facility, then the nurses now will start their triage by separating them from each other. And they said the reasons for disaster triage are: 1, for adequate resources to meet immediate need. The little facility on ground will be used wisely, because if you are taking care of somebody who has sustained injury, severe injury, and somebody who is bleeding, or somebody who is having respiratory breathing difficulty aside, and not taking care of some patients that are ought to die, or they are dying, or they are dead, before you waste all those resources on those people now, and those patients are still liable to die or died as at that time, you see that then you are now leaving somebody that is bleeding aside. Before you finish your resources that you have wasted on those patients, you will have utilize all those resources on people that are on the red code. That's adequate resources to meet the immediate needs. Then number 2 is infrastructural limitation. The bed that you have, maybe you have 25 bed capacity in your ward. Now you will now occupy those 25 bed capacity with somebody who has severe burn that's likely to die, or you have bed capacity of somebody who has head injury that's likely to die, and somebody who's bleeding profusely, or who is having respiratory compromise, are left outside. So eventually those people that need to be received with attention are left outside to die, while those people that are liable to die, or they are to die due to the cause of their accident, are taken care of, and eventually all the resources and material are wasted on them. At the end of the day, there will be no result for that. Then the third one is limited transportation capacity or capability. The vehicle you are taking there can only contain maybe 5 or 6 patients, and the casualty that are there are up to 15 or 18 or 20 or 30. Then the vehicle there can only contain only 5, 6, 7, 8 patient casualty. Then under triage, you'll be able to separate them so that you move those ones that truly needs your immediate attention without transportation. So with limited transportation capacity, you'll be able to move the real patient that require emergency management, who are on red code or on yellow code, immediately to the health facility. Then the fourth one is hospital resources overwhelmed. The resources in the hospital will be overwhelmed if all those people are brought at the same time into the facility without triage. You see, the facility there will be overwhelmed. That is, the capacity of that facility will not be able to take care of those people that are massively injured due to disaster, without triage being done on them for you to separate those people that really require the services of that facility there. Then number 5 is inadequate hazard preparation. Since you've gathered everything together to use at the same time, it will not give you room. Without triage, it will not give you room on how to prepare those patients so that they get efficient and adequate management, so that the practice of standardization will not be there. So that with the aid of triage, we'll be able to separate the adequate one that are red code and yellow code for immediate management medically or surgically. Then the last one on reasons for disaster triage is multiple agencies responding to disaster management. With the cause of a disaster triage, you'll be able to invite people that are entitled to come and join you to work, like the police, like the ambulances, like fire services, like others that are liable to come and join you to enhance your capability in separating those people from their from their scene of accident. Those are the reasons for triage. Then if we look at the principle that is guiding disaster and emergency, the principles that is guiding disaster and emergency, principle of disaster and emergency nursing. What are the principles? One of the principle says that there should be a rapid assessment of situation and nursing needs. Rapid assessment of the situation and nursing needs. Those are the principle. So number two, there must be evaluation of the environment and the motivation or removal of any health hazards. Evaluation of the environment and the motivation or removal of any health hazard. Under this evaluation, the area at which something happened, you need to evaluate the environment. Then what are the motivation? How do you remove people from hazard area, or how to prevent hazard from occurring as time goes on. Then the third principle is triage and family initiate life-saving measure, where you separate them from other danger activities. When you separate them from other danger activities, you'll be able to initiate how to give life-saving measures, like somebody who require stitches with severe bleeding, requires stitches, being rushed to theater to save life, and the one that required oxygen is being rushed to intensive care unit, or where he's being given enough of oxygen for him to survive. The problem is facing, they are under principle of disaster and nursing management. Then the fourth one is prevention of further injury. Like when there's accident or when there's disaster, prevention of further injury and illness are always never taken care of. When somebody is involved in a road traffic accident that involves massively, people that are entitled, maybe sustain fracture, sustain anything, disability, people that are entitled to lift such a patient or casualty as at that time are people that have the experience of how to rescue people from that kind of accident. In the course of negligence or carelessness, you see many of the casualty will even develop spinal cord injury because of the manner at which they are being rescued, but being properly or poorly handled leads to a lot of destruction and leading to death of most of the casualty due to lack of adequate management. Then number 5 of it is adaptation of necessary skill to disaster and other emergency situation. So you get used to the practice. How do you practice it? You need to get adapted to it. How do you practice? What are your procedure? What are your responsibility? You must have the knowledge of how to rescue casualty from the accident scene, on how to rescue them one after the other, on how to create a triage, and how to move those casualty individually, collectively to the health facility. There are the adaptation of necessary skill. The skill itself is how to do it, and the technical know-how is known as the necessary skill. You must have the technical know-how of how to handle all those cases. Then the next number is the selection of essential nursing intervention and the elimination of non-essential nursing activities. When you bring them in, the essential of nursing intervention, you see somebody that is having compromise in respiration, is known as a difficulty in breathing, you should be able to know that this patient will require oxygen, will require removal of tight materials along the waist of the patient or along the chest of the patient, ensuring adequate ventilation by putting the patient in the right position to enhance adequate breathing. Then the patient that is bleeding, you should know that from the scene of where something happened, you ensure that the area that is bleeding tourniquet is applied at interval of 15 minutes. You be released. After you release it, up to the time you get to a health facility, you'll be monitoring the area. You tie the area with tourniquet. After tying tourniquet, in 15 minutes interval, you release the patient so that the blood supply to that area is not compromised. There's somebody who sustained fracture, maybe fracture of the spine. Then there's a procedure of moving such a patient from the accident scene or from disaster scene to health facility, in which was only people that are properly trained on how to handle accident and emergency cases that are liable to move that kind of patient to a health facility, so that more trouble is not caused for such a patient. And next one is leadership in coordinating patient triage, care, and transportation to the appropriate health center. Under leadership, we have coordinating. In coordinating, there must be a sign of duty to everybody. It's not one man is a foreman, where one man can do four people's job, according foreman, or where one man is handling everything. No, everybody must be tasked with his kind of work that is going to save situation of the patient, not jeopardizing the patient health, and making sure that the victims that are there are properly taken care of. Then the last one under this is known as teaching, supervision, and utilization of auxiliary medical personnel and volunteers. So you see, teaching and supervision, as a leader, you need to make sure you coordinate all these activities perfectly. Make sure you use those people that are necessary to be used, like the auxiliary medical personnel. Even the cleaner is important at that time. People that are involved are fire service, police. They may not know much about health, but they're part of emergency management service team. So they are all involved, and you have to make sure you supervise them, you teach them what to do, and let them carry out all their activities. With this, be able to know the disaster and emergency, how to handle them, how to care for them, and how to make them live successfully. At the end, we have glory. We have ability to glorify God in rescuing life and property of that environment. We come to the end of today's lecture. By special grace of God, next week we continue with our live broadcast, our live lecture that we are going to meet one-on-one. I indulge all of you to please ensure you pay all your school fees. As the coordinator have been saying, only your school fees will guarantee you to come online live to witness your lecture live. And the better you witness your lecture live, the more understanding you get, and the ability for you to become something will be there. So I wish all of you the best of luck as we progress in your studies. And in this semester, I wish you that God will continue to provide. When we still have the fund of paying, God will provide for you to pay. Have a nice day. Remain blessed. Thank you.